Good morning and welcome back, everyone. My name is Justin Poulos. I'm the Director of MTSS at the Office of Superintendent of Public Instruction, OSPI, in Washington. I'm going to get us started. It is, we're at 10:30. We have an amazing presentation ready for you with amazing presenters, so I don't want to waste a lot of your time. We have over 250 of you on this webinar right now. We will record the webinar and we will post it around May 4th to the OSPI MTSS webpage. Slides will also be available there under agenda and registration. And with that, I am going to introduce to you two amazing women that are champions for our students all across the state, have been doing amazing work tirelessly to build and support systems to reach out to each and every family. And they have both been working to build systems that are integrated into their MTSS framework. And with that, I would like to introduce to you Kelsey Schmitz at the University of Washington Smart Center. And she's also with the Northwest Mental Health Technology and Transfer Center. And Tawny Barlow, who is the Director of Student Services for the Medical Lake School District. So please welcome these two wonderful ladies. And with that, I'm going to turn it over to you both. Thank you.
All right, thank you, Justin. And before we get started here, we just want to give a huge shout out and thanks to Justin and the OSPI staff, to Robin and to Shiloh, who I know have worked really hard to bring you all this virtual MTSS Fest opportunity. So just want to give a huge thanks to those who have been working tirelessly themselves behind the scenes to put this on. I'm Kelsey Schmitz, and I work at the University of Washington Smart Center, the School Mental Health Assessment Research and Training Center. And I work on several projects within that center. I lead the School Mental Health Supplement to the Northwest Mental Health Technology Transfer Center. And I'm joined today by my amazing co-presenter, Tawny Barlow. And Tawny, you want to introduce yourself?
Hi, everybody. I'm Tawny Barlow. I am the Student Services Director over in Medical Lake School District, which is about 15 miles west of Spokane, Washington, so on the eastern side. And I'm fortunate enough to not only work with Kelsey, but work with the OSPI MTSS team, and as well as Susan Barrett with Integrated Systems Framework. So I'm super excited to talk about our experience and what we've been learning. And without further ado, I'll give that over to Kelsey.
All right, and for those of you who weren't on when we were getting started in testing audio and video, Tawny and I are in our matching MTSS Fest shirts. So I know they're a little hard to see, but we just wanted to show you all that we're huge supporters of MTSS Fest and happy to be here and happy to bring you this presentation. For those of you who listened to the keynote, I think George did a fantastic job of setting up really what some of our key messages are going to be here as we talk about school mental health within an MTSS framework and using those MTSS features to install school mental health. So just very quickly, we are part of the Mental Health Technology Transfer Center Network, which is a network of 10 regions across the United States. This is a SAMHSA funded project that was funded in late 2018. So we run out of the UW Smart Center, the School Mental Health Supplement to the Northwest Mental Health Technology Transfer Center. And we support workforce development for school mental health in Alaska, Oregon, Washington, and Idaho. And I just want to give a shout out to my team, Megan Lucy, who's our program coordinator, and Eric Brenz, our project director, and also direct you to our website. We did post the PowerPoint, so you'll have access to all of this, all the information and all the links that you can go back and check out. But we invite you to come to our our website and see all the resources and trainings that we have available on demand for you right now. And we'll talk a little bit more about those as we go through the presentation. If you're not familiar with the UW Smart Center, this center was founded around 2013 with the focus to promote high quality, culturally responsive programs, practices, and policies to meet the full range of social, emotional, and behavioral needs of students in both general and special ed contexts. We are a unique center, and we have faculty and staff that are from both the School of Medicine, UW School of Medicine, and College of Education. So diving into our session, these are the things we hope to accomplish in the next hour. It's a bit ambitious, but for those of you who know me, know that's kind of how I roll. We have embedded a lot of links and information and have some steps at the end, some clear steps that you can take after listening to this webinar. So we want to go over the key messages of an interconnected systems framework and really tell you what that is about. We want to discuss the strategies to align PBIS and school mental health. We want to help identify some initial steps, whether you are just getting started or you're moving forward with integrating school mental health. We're going to turn it over at some point, hopefully sooner rather than later, to Tani, so you can hear about their journey in their district. They are also a national ISF demo site, so we're working with several other states around the nation to create some demo sites and really provide some intensive TA. So I'm excited that here in Washington, we have 2 demo sites, Medical Lake School District and North Mason School District, as well as other efforts that are underway in our state using the ISF framework, one being through the Washington School Climate Transformation Grant and the Seattle Public Schools School Climate Transformation Grant. We also want to provide for you where you can find some free and easy to access resources, tools, and other materials to assist you in installing school mental health within an MTSS. So before we get started, I just really have to recognize that we are standing on the shoulders of giants in this work. There have been many amazing people. Some I think might even be joining us today on this webinar. That have been really bringing this work to all of us in schools and districts. And first and foremost, want to recognize that national ISF leadership team led by Lucille Eber, Susan Barrett, Mark Wiest, Kelly Perales, and they have several other colleagues. I also want to give a huge shout out to Susan Barrett, who's working closely with us in Washington from that team. We're very, very fortunate to have her knowledge and wisdom and experience to guide this really critical work in our state. We also want to thank the Center on PBIS, the National Mental Health Technology Transfer Center. We work closely with another regional MHTTC, which is the Pacific Southwest. Our close partners at Northwest PBIS, Jessica Swain-Bradway, who many of you may know, who's the executive director there, and the National Center for School Mental Health at the University of Maryland. So I think we know now more than ever that schools play a critical role in supporting the emotional wellness of our children and youth. But even before the global pandemic, educators were feeling the increased needs for mental health. Schools have become the de facto mental health providers. And we are seeing an increase in the need for these supports in our Healthy Youth Survey data. I know some of you may not be from Washington, but you may have similar type of data that you collect from students where we're seeing an increase in anxiety, depression, suicide attempts and thoughts. And in Washington last year, we had 100 youth die by suicide in our state, which is an average of 2 per week. So we know that many of our youth that require mental health services don't receive them. And of those who do, 70% are receiving those in school. And we know that schools are a place that can improve the access to service for underserved youth. And I will tell you the thing that, you know, is kind of keeping me up at night, and Tani knows this and probably is also keeping Tani and many of you up at night, is if schools are providing 70% of all of those mental health services for students, how are we doing that right now for our kids during the school closure? So we know through a meta-analysis that happened in 2011 that social emotional learning programs have a direct correlation to school achievement. And we know that positive school climate can buffer youth from external factors. So with the magnitude of the issue around the increasing mental health needs of our students, of our staff, of our families, it's really going to require us to think differently and respond differently and set up our systems differently to support students. So schools are moving to adopt an MTSS framework that's based on the public health model. Again, if you heard George this morning, you heard him describe MTSS and its features. We do know that school mental health is more efficient when provided within an MTSS framework. It allows supports for students to be provided different times throughout their development where they may need different levels of support. It allows tiers to be layered. So you also heard George mention that students that receive tier 2 and tier 3 supports still continue to benefit from those tier 1 mental health promotion supports. We really have this need to invest in tier 1. Again, I'm going to say this is something we heard from George in the keynote. We really need to intensify what we're doing around tier 1, around mental health promotion, so we can reduce the need for higher level supports for students in a school or district. And then within the MTSS, we're providing intensive and targeted services to students that are have more serious or at risk for more serious mental health concerns. So Justin said before, we had to agree to present, we had to have at least 3 triangles in our presentation. So if you're following along at home, I believe this is number 1. So many of you have seen this, many of you have something similar at your schools or district. And I just want to take a quick opportunity to reiterate the need for a clear, organized framework that really helps our staff, our family, and our students with understanding and with buy-in. So this example here, and yours may look different, but for all students, there are a set of interventions that we provide for all students. You can see an example of a menu of supports that can be offered for all students. For students who need a little bit more, we have an additional layer where, you know, increasing the dose and intensity, and we might be providing additional supports for those students who need more. Again, layering on what we're offering in tier 1. And then we know we will always have students that need targeted or intensive supports. And I always think about a mentor of mine, Dr. Kathleen Lane, who's at the University of Kansas, who says, you know, it's not a tragedy when students need more. We just need to be prepared for those supports and not wait until the crisis arrives to put things into place. So 2 other very critical features to MTSS include screening. We have to have a way to detect those students who might need more. And we have to have a way, once they're in those supports, to monitor not only is the intervention effective, but is the intervention being provided with fidelity. So progress monitoring includes fidelity of implementation and effectiveness. So this next slide really kind of addresses the limitations that we've experienced with PBIS and school mental health, and therefore the need to bring these things together. PBIS has been implemented on a scale of social significance and has many benefits, but we need more. Often schools struggle to implement effective interventions at tiers 2 and tiers 3. We also have an issue where we are challenged to align the multiple social, emotional, and behavioral initiatives that we're implementing. Susan Barrett often says, you know, popularity breeds fragmentation. So what we often see in schools are, you know, adopting a practice for every problem and a team. So we have these multiple teams, we have school climate teams, we have mental health teams, we have safety teams, and that's, you know, that's really challenging, especially when we're asking and we're training educators and our staff in all of these different things and expecting them to do the alignment. And that's really the job at the, you know, at the district and the state level to help show how these things work together and can be better aligned into a framework. Often youth with internalizing issues may go undetected. In PBIS, we're often looking at office disciplinary referrals, which tends to only capture students who have externalizing issues, who are acting out. So we need a way to detect students that might have symptoms of anxiety and depression. There's also this issue of not having enough staff and not having enough resources. And so we would argue that there's a need to even just reposition the staff that we do have. And although we've had a lot of success with improving school climate and discipline, we often leave out broader community data, and we often leave out mental health prevention. When it comes to our connections to our community health providers, those connections may be ad hoc, they may be weak, and we really need to have those community partners integrated into school teams. I think what the model most people are familiar with is a community partner comes into a building a couple times a week, sees a few kids, and then is gone. And we're left kind of wondering what's going on in there. And having those community partners not only provide services at the advanced tiers, but we really, really need those community partners at our tier 1 team to be looking at what some of the most common issues are in our school. You know, maybe it's anxiety, maybe it's depression, but we need their expertise at the prevention level to tell us ways that we can be implementing interventions for all of those students. And to do that, we run into this issue of funding and support for those partners to function at tier 1 and tier 2. You know, in that traditional model, they're really more co-located and not integrated. So we need more systematic memorandums of understandings that clarify the roles and the functions of those integrated teams. So this slide kind of illustrates how school and community providers can work to expand that continuum of supports. So these partners really increase the capacity to provide supports to students. So we really like this slide that kind of illustrates where the strengths lie in our school providers and our community providers. And as we move through this presentation, we're going to talk about the interconnected systems framework that is really bringing these things together, our education and our mental health providers together, so that we have one system instead of parallel systems. So I know some of you have probably seen this slide before, and I want to give credit to Sandy Chafulius, who's at the University of Connecticut, and her team for putting this together. But take just a moment to review this graphic. It really illustrates the weaving together of school supports and community supports into one system. And this is populated with interventions that may or may not be relevant to your school context. So just know that, you know, this gets populated based on your community and your school data, and identifying what needs your populations have across the continuum of support. So when we move from a co-located to an integrated system, we have our school and community employed staff that are using both community data and school data that assess the need of the young people in their school community. And then they work together as a team to select evidence-based practices that match the specific needs of their community. So that really kind of takes us into this definition of the interconnected systems framework. And it's at this point where I want to say, you know, we apologize for offering yet another acronym in education, and you no longer have to ever use this term again. If you have a whole child effort, if you have an MTSS effort, if this is the Highline Way, this is not, we are not saying you have to use this new term. We just want to be able to explain to you how you take what you're already doing, you identify your needs and your gaps, and you bring in your community partners to expand and enhance your continuum of supports. So the ISF framework really came about after two groups came together. The National PBIS Center and the National Center for School Mental Health really came together to address the gaps and needs across both approaches. And ISF is a deliberate application of the multi-tiered PBIS framework for all social, emotional, and behavioral interventions. So it's aligning all of those social, emotional, behavioral related initiatives through one system at the state level, the regional level, the district, and the school level. We call that kind of the cascading logic model. And I can tell you that through Justin's leadership, the other folks at OSPI, through the School Climate Transformation Grant through the state, we are operating at a state level with a state level team that is focusing on this interconnected systems framework approach with those districts that are participating in the School Climate Transformation Grant. And so we have the symmetry of process that we look for. We have a state team, we want regional teams, we want district teams, and we want building teams to all have this common thread of aligning initiatives. And then critically important to the interconnected systems framework, and really frankly, just all the work that we do, is active participation of family and youth in this work. So ISF is a structure and a process for education and mental health systems to interact most effective and efficiently. And it's guided by key stakeholders, key decision makers who have the authority to reallocate resources, change role and function of staff, and change policies. Our partners at the Pacific Southwest, MHTTC, worked with Susan Barrett and others at the Center on PBIS, and they've created these amazing fact sheets. So if you're just getting started with ISF, they have these fact sheets, a 101, a 201, and a 301 fact sheets, and we'll show you here in a bit where you can access these things. You know, ISF is being implemented, we know, in schools and districts in about 30 states, and there's also been one randomized control trial that shows some really good results when there is this interconnected approach as opposed to sort of co-location or parallel approaches. So again, George could not have set up this presentation better in his keynote by talking about the MTSS features. we're utilizing all of those MTSS features and really thinking about, when we talk about teams, those teams include community mental health providers. Our data includes school and community data, right? School data beyond ODRs, attendance, nurses' visits, any time out of class. We have a formal process for selecting implementation and evidence-based practices across the tiers. And this is done within a team approach, which is different than what many clinicians might be used to when they come into a building and make the decisions themselves. In the ISF approach, this is done as a team. A focus on early access by utilizing comprehensive screening, which is looking at both internalizing and externalizing needs. Rigorous progress monitoring, both for fidelity, did it happen the way it was intended to happen, and for effectiveness of all interventions, regardless of who's delivering that intervention. And that we have ongoing coaching at both the systems and practices level. And you can read more about these MTSS features and applying them to social emotional behavioral interventions in the 201 fact sheet. Again, we're going to tell you where you can find those here in a bit. So what's different when we think about a traditional siloed school mental health approach? Each school has their own plan with a mental health or other service agency. Versus in an interconnected system, we have a clear plan that's developed at the district for integrating mental health and other services at all the buildings based on school and community data. In a traditional approach, as I mentioned earlier, clinicians are placed in one school, in a school 1 or more days to provide the services to students. Versus in interconnected systems where teams at all 3 tiers include a mental health professionals, and that teachers are aware of what students are working on in those sessions, so they can incorporate that skill building as part of their tier 1 approach. In a traditional approach, school personnel work in isolation, attempting to do school mental health, versus interconnected system where there's a blended team of school and community providers working collaboratively. In a traditional approach, there might not be any data used or available to select or progress monitor interventions. And typically the only data that's collected is the number of students who access mental health services. And we would never take this approach to reading. We would never say there are X amount of students in a reading intervention. We need to be looking at our data and progress monitoring the effectiveness, the impact of those approaches. So in an interconnected systems, we're moving from access to outcomes, and we have a team. The team is selecting the mental health interventions and their progress monitoring approach that's applied to all the interventions, regardless of who's delivering those interventions. So some benefits of ISF are we uncover students with mental health needs earlier. These are also some things that have been found in the randomized control trial. We're linking students and families to evidence-based intervention. We have a data tracking system to ensure that students are receiving interventions and showing improvement. We have expanded roles for clinicians to support students as well as across tiers of all support. And we see a healthier school environment. So the key messages of ISF are kind of boiled down to, we have a single system of delivery that's happening through one set of teams. That access isn't enough. And if you've heard Lucille Eber talk, you know, she always says referral is not an intervention. We have to determine effectiveness based on outcomes and impact. Mental health is for all. So part of this key message is that the district is prioritizing staff wellness and also ensuring that we're not leaving, you know, mental health up to the mental health professionals, that everyone in the school is a mental health ambassador and supporting the promotion of mental health and wellness. And then finally, MTSS is essential to install mental health, school mental health. So the steps for installing this at the district level are really kind of boiled down to these five steps, starting with establishing a district and community leadership team, assessing the status of mental health and PBIS systems in the district, reaching team consensus on a mission statement, establishing a district and community leadership team, procedures and routines, and developing action plans to support demonstration sites. So let's just take a deep breath. I know this is a lot coming at you, and I want to provide some reassurance that some really smart, hardworking people have created some really nice materials that can help you kind of walk through this process, through these steps. And so let me show you one of the most amazing resources that I think is absolutely critical in this work. In 2013, there was a monograph that was put out by the National ISF team, really describing and providing some examples of interconnected systems framework. And in 2019, they took that work a step further and created this implementation guide. So if you're sitting in your home office / you know, home school, wondering, this is great, but where do I get started? This is where you get started. We would highly recommend you using this implementation guide and doing a book study and walking through the chapters. I want to highlight, though, Chapter 4 and Chapter 5. Chapter 4 is on installing an interconnected system at the district and community level, and that is Chapter 4. Chapter 5 is sort of that symmetry of process at the school level. You will absolutely love what the team has done here in creating a step-by-step guide for the district and the school team. So this is just an example of what you would see in that installation guide for that first step, which is establishing a district and community leadership team. So it provides you the features, what activities you'd be doing, space for you to document your actions, and then some guiding questions to walk you through each of these steps. And then, as I mentioned, there's a parallel process then at the school level through the school installation guide. What's nice about these installation guides is that they're hyperlinked to all the tools and resources you need. So if I go back just a couple more and you're looking at this implementation guide, you'll see it says District and Community Leadership Installation Guide, and then underneath it says click here to access supporting resources. This is an entire Google folder where you will find just a wealth of resources, tools to help you with this work. So that first step of establishing a district and community leadership team is truly essential to guide this work. If we just focus on the building level will have barriers that will stall implementation, especially when it comes to the roles of the clinicians within MTSS, issues around confidentiality, and agency productivity and funding policies. So a lot of this you can read about in the 301 fact sheet. There's two really key functions of the district and community leadership team: the executive functions to provide funding, visibility, and political support, and the implementation functions to provide the training, coaching, and feedback systems. And then, you know, just a little note at the bottom, doing this work, adopting an integrated framework, will challenge the assumptions that many of us hold and the traditional practices of most school faculty and mental health systems. So the second step would be assessing your context. What is the status of these things? What is the status of PBIS and school mental health? What is the status of your existing partnerships? And what are your leadership structures? So a lot of people have been really interested in this idea of resource mapping and doing an initiative inventory. As I mentioned when we got started, we see multiple teams in a school. And so it's really important that we take stock of what those initiatives are and think about how we could work smarter, not harder, and maybe combine some of these really similar initiatives into a tier 1 team. So this is just an example of how you could do an initiative inventory and help with some of those discussions. The third part is reaching a consensus on a mission statement. So we have a purpose for our team, we have goals for our work, and we create a shared vision to communicate to stakeholders. And this is actually where I'm going to turn it over to Tani, where we're going to hear about how they have been doing some of this work in their district. So Tani, it's all you.
Okay, well, thanks so much. This, just like Kelsey talked about, as you bring together all of these disciplines, it is, it's a little overwhelming if you think about it, but I'm excited to share with you the work that we're doing, and then I'll talk about some of the key players as we go forward. But so we are trying this work. I would tell you that it might be easier that we've started this at a smaller school district than a larger school district, but I think that this model could be duplicated in all size district. It just really requires passionate people and support at all levels. So just to give you a quick snapshot of what our district looks like I said, we're about 17 miles west of Spokane. And our district on any given year is usually about 2,000 students. You can see that we have 5 different schools. One of them is on a military base, which brings different components when we're working with military families. One of the great positives about being in the Spokane area is we are next to 4 universities. So when Kelsey's talking about partnership, this is really where we have honed in on partnership, is using our experts in the universities around mental health and social work and school psychology. We really are taking advantage of all the disciplines, and I'm going to talk to you about how that works, especially as Kelsey talked about the taking an inventory in the different areas, whether you're talking about suicidal assessment, academics, mental health, just PBIS, all the areas. It's really utilizing all the different disciplines in your school system. One of the barriers for our school district is our transportation system is lacking in a centralized way. So if you move from Medical Lake to Spokane and a student were to be involved in a mental health appointment, it really is about a 4-hour round trip, which doesn't make sense because we're only about 20 minutes from Spokane, but the way the system works, the way it transfers, it doesn't move from our local little cities of Cheney and Medical Lake and Airway Heights. It moves to Spokane and then back out again. So it's definitely a barrier for us. Another barrier for us is that there's no mental health within our city of Medical Lake. So that's probably one of the pushers to get us to start this program. Another thing to know about our district is that we're about 40% of free and reduced. So family having the resources and services to get connected to mental health is a large component and an area to be considering. My area of expertise is I work with special ed, 504, nursing and mental health. So really all about student services is an area that I'm supporting in. Let's see, switch to our next slide. So as Kelsey's talking about our integrated approach, it really, we aren't using the ISF term, but we are a demo school for ISF, as well as we're working with Seattle Children's for our mental health consultants as well. We really look at our system as a whole child. And when we talk about what's our goal, and when we talk about the goal of MTSS and bringing in all of our services, we really want to get comprehensive, not only with the academics, but behavior. So this is our approach as we use the ISF model. And I'll have Kelsey switch. And when we used our, when we were bringing our goals together and figuring out what our mission statements were, we did use the Healthy Youth Survey, and we looked at some of our numbers, which I don't know if you have, as districts, have reviewed your Healthy Youth Survey information, but I would encourage you to dig into that information. It's very informational. It's a little bit heartbreaking for me when we looked at this information, but it was also kind of a call to action that says, we have this information and we need to do something about it. So when you look at our goal 1, it really was to enhance capacity with those partnerships that we've talked about in all the areas, in that comprehensive area of social, emotional, academic, all of mental health, all the different areas. And number 2, it's really to build that partnership and capacity with our educators and our mental health, all of our different disciplines. Like Kelsey had talked earlier, we haven't usually trained and brought those groups together at tier 1. So as we build this system, we are building it at each level. And so that's our goal too, is really to build the capacity and how that works in all areas. So from a tier 1 all the way to tier 3, when you move to, a serious, like a threat assessment issue. And then when we move to goal 3, it's really to see improvement, and you're going to see, the academic growth. We want that to increase. We want attendance to increase. We want substance use to decrease. So that's where we are really looking at measuring our performance. Those are the three goals that we're working on. So for Justin, here's another one of our triangles. This is a mental health triangle and social emotional. But what you're going to see us do, and I'm going to bring this up in one of the later slides, is how this really fits with academics, how it all comes together. This is really a repeat. It looks pretty similar to the one that Kelsey presented, but this is what Medical Lake School is doing for our tier 1s. And as we start right here, I just want to really talk about that this work is really supported to get all of these systems to work together. It's supported by our administration, as well as to bring in all of our different disciplines. People ask us, how are we doing this work? And we do this work with a variety of different people, but our school counselors are our hub for the information. We are working with 4 different clinical supervisors, and people are wondering how does Medical Lake do that? I just have to give a shout out to, as a district, we did hire a mental health therapist, and that's Suzanne Greenhall, and she's really a key component of bringing all this information together. And then we have clinical supervisors. So as we bring our disciplines together, we have a clinical supervisor, which is Dr. Robin Andrus, school psychologist, Dr. Teresa McDowell, school psychologist. She also has an MSW. And then we've really gotten creative, and we're using volunteers, other people within the community. We have a Fork School District, Mabel Thackeray. She's also one of our clinical supervisors. So this presentation won't be able to get in our whole framework and how we're doing this work, but we're really pushing on being progressive. How do we take care of the mental health of our students and our staff in a time where funding and finances is a concern? You have to get creative and you have to have passionate people. So we have passionate people to do this work. These are our tiers that have built this work. So you'll see, you know, a discipline of school counselors would be working at tier 1, school psychologists would be working at tier 1, our school nurses, our classroom teachers. They're all using these staff break room or student break rooms. They're putting out the Mind Your Health newsletter. So all of those different disciplines and teams are putting that information out. We're providing education. All of those specialists that I just talked about are providing education for our educators and for our parents. So one of the things that we've done is when you're looking at tier 1, we are working with Whitworth University. We're working with Eastern Washington University. We're beginning the process of working with Gonzaga University, and we've brought in social workers, school psychologists, marriage and family therapists. Obviously, we're working with school counselors. And so we're bringing those highly trained expert intern levels in when they're on their 3rd year, and they're helping build this infrastructure that you're looking at, which are the newsletters, delivering these classes, substance use prevention, helping teachers deliver the social emotional curriculum. How will we handle like school meetings? And so we're really partnering with our educators. And again, we're working alongside them at tier 1, tier 2, and tier 3. So then when we move to tier 2, we've done some progress monitoring. We've identified kiddos that need more support. And so that's where you'll see tier 2. And then as you move to tier 3, we really come around with some wraparound services, and we're delivering individual therapy, family therapy, and you're seeing that with our family therapists from Whitworth. They're marriage and family therapists, interns, and they're supervised by all of us as the clinical supervisors. And so, you know, currently, I believe we have approximately 70 people being served, students and families and staff. This model is also serving staff as well. And we have about 70 individuals that are being served at that tier 3 level right now. So with this, Kelsey had asked me, as we've put this, our program together, it's been, I wouldn't say operational, but we began the pieces at around 2018. And she wanted to say, what are 10 things that have gone really well? I'll tell you that on number 1, that teachers and principals have been able to express that their jobs have changed. One of the high school principals shared with another school, because they came out and said, hey, we want to see what you guys are doing. And the high school principal shared that his office referrals are down. We've looked at the data specifically with our PBIS and our Swiss system. And one of the months when I was attending the meetings and they were down to 10 referrals for the month, and we said, you know, that's high school. That looks really great. He said his office has changed, that it's not filled with 25 people sitting in his office, where he's delivering mental health, help for families, help for students. He's still obviously working with families, but he feels like he's able to kind of hone his skills in as the principal versus dealing with all these external barriers and areas that need help. So that's been a big celebration. We've also had those providers and therapists in working with the teachers, and they've expressed a sense of relief as well. So then when we move to the second celebration that we've had is our school counselors. We've really looked at them as the hub before we intervene at any of the other tiers, is they are really able to redefine what the school counselor's role is based off the ASCA model. And you will often see counselors go back to, you know, is this really the model? Is this really the work that we should be doing? And our school counselors have, we're meeting as an entire team together, and we're able to look at their job description. And with that, because we have so many people helping at tier 2 and tier 3, they're able to do some of those tier 1 things. So they've, at our high school, they created a wellness room. It's called a calming room. It's really, a lot of staff just like to go in and sit. They call it our Cardinal's Nest. And so they're delivering tier 1 and tier 2 interventions. And they're really, at any of our MTSS meetings, they're really the hub of, as we move out referrals and other interventions. So that's been a big celebration, is to look at what school counselors should be doing. The third celebration is that we fold in the already existing framework. So I'm with Kelsey, and when we have all of these different acronyms of PBIS and SWIS and ISF and IEPs and SDI, I really could probably have about 4 pages of acronyms in the education world. The positive about this ISF work, and there I'm using it again, this whole child work, is we're working smarter, and we are not using so many teams to disaggregate data. We're using more of a one team, one lens, whole child, whole family. And so this next slide, everybody gets really excited about. And the reason why they get so excited about it talks about how we overlay this entire system. So these are our, it looks like it's kind of hard for you to read probably, but these are our interventions that we use from an ELA, math, social, emotional, and mental health, and we put them all together. So as these teams meet, they have a kind of a menu to work off of, and work off of evidence-based interventions, framework. It's an area for us to deliver training around, whether it be curriculum, or how do we get these interventions in motion. Now, just bring you down to the mental health tier when you're looking at this area, especially with today's time. We've brought in the telehealth at tier 2 and tier 3. That's been growth for us. We're working with Seattle Children's in a small Pal grant for using telehealth and consultation. And our therapists are also delivering telehealth now. And we'll talk about that in a little bit later. And that took a little bit of quick feet and really passionate, strong staff to get our system in place. But I will tell you, as Kelsey talked about, having this system in place prior to COVID was helpful because we could really identify the students and families that were in need and would immediately need services. So it's a quick snapshot of all the interventions that we're using at Medical Lake. We are constantly adding and tweaking this. So probably next week, this will be outdated. We keep our form on a Google form for all the different schools and continue to update as we use these interventions. So our next celebration that not only from the administration level, but at family level, is having immediate response to crisis. So those of you schools that have gone through threat assessments, obviously all of us deal with suicidal ideation. The principals, administrators, families, teachers have been, had this sense of relief almost that when we go into, when we get into an emergency, like a threat assessment, and you have some recommendations that came out of it. So most of you probably deal with threat assessments where the situation was a threat came out of it, but the student really needed support versus it moves to a level 2. And that's where most of us are sitting, that this is a reactive threat and the family and student need support. So the administrators have been super relieved that we have a tiered response where we can immediately get services and help, having this mental health involved within our tiered system. Our fifth celebration was that we're serving a variety of different populations. We're serving people that make too much for Medicaid, that can't afford services. We're serving the people that don't want to take the 4-hour trip and lose academic time. We've also been able to serve some of our military families that may not access their own services due to concern and worry within their organization. And here's the great celebration on number 5 as the free services. So we really can tell you that we're offering free mental health services to all students, families, and staff. And you might think, well, will the staff access these services? They're seeing these therapists every day in their schools, and they've not only accessed their services, they've brought their children, they've accessed them from a family perspective. So when we talk about tiered services, one of the areas that I consistently talk with our district and the leaders at OSPI and Smart Center is, what about the wellness? What about the tiered system for our educators? Because they're working with kids of trauma and kids in tier 3. I'm so pleased to see a system that we can access and help our educators as well as their families. The other celebration out of that is that we have kids referring kids, that they're your best referral agents because they're able to say that, this helped me, or this is who I see, and this is what I'm working on. And so that's been really a celebration for us. As the number 6 for a celebration, like I said, our district, our school board supporting, we hired one of our interns, and like I said, she really is doing fantastic work coordinating with all the different disciplines, as well as we are continuing to look at needs assessments. Again, that's our school counselors are really the hub of that information, working with all the different disciplines. As Kelsey talked about, with this system, we're able to use our school psychs to collect data, to look at trends, to bring together the SWIS information, the attendance, academic growth, working with the school nurses. They've created a system, the school psychs have, where they're working with the school nurses and able to identify those kiddos that are that are always out at 3rd period because they have a stomach issue or headaches, and school psychs are looking in that at detail. Is it always on Thursday? Which helps us for our effectiveness and who we need to assess. So, the celebration about assessment, I will tell you, this works because we're using all the disciplines, from school counselors, school psych, our social workers are accessing those community resources and creating the partnerships. They even created a system now where they created an Excel program of all of the community resources. Those social workers made contact, found out the real live email, operations time, how people can access the services. And so if a family therapist is working with one of our families, they will immediately contact the social worker intern and say, hey, we need housing resources, and these are our constraints, and the social workers get that information over to the family therapist. So really, this is I can't tell you how proud I am of having all the disciplines working together and why you need each one of them, because they all have a specialized expertise and role.
So Tani, as we move to this next slide, and we're about to the end of our time.
Oh, yikes.
What of these last celebrations, can you pick one quickly to talk about? And then we'll pick one of the lessons learned and then move on to resources. And if people want to stay on a few extra minutes, I think that's okay. But yeah, which one of these would you highlight?
I would just highlight that this is a system that we're creating to ripple out statewide as we work on the forecasting and what it looks like for our budgets coming in. And you can see that we're already starting to assist with Central Valley School District, Fork School District, and we're trying to create a system that we can ripple out across the state that can help, as you talked earlier, that mental health ambassadors, mental health is everyone's job. And we really want to support, help all educators and help families.
So one lesson learned.
Whew, we learned some lessons building our plane in the air. I would tell you a lesson learned for us is really out of all of these is having the infrastructure, trying to get the infrastructure set up prior to bringing them in. We have a total of, I think it is 13 therapists, interns from one of those different disciplines working with us, as well as our 4 different clinician supervisors. Really having that that delineated who's doing what would be helpful prior to bringing everybody on.
I know you had, you were able to talk a little bit about your COVID, and that should be COVID-19 as in the year 2019.
Yeah.
We kind of added that last minute, but you had a chance earlier to talk about the importance of having this structure in place and how it's helped you with being responsive now. So huge thanks to Tani for sharing. She's always up to talking to anyone about this. So we'll give you her email address, and you definitely should connect with her. They're doing great work.
Sorry about my time.
Justin, will you let me do resources? I can do it quickly.
Please, yeah. And then if people want to stay on just for a couple minutes for a couple of the questions we have,
Sure.
Can we do that?
Sure. So this slide just talks about what next steps can you take now. You've heard Tani and I sort of introduce this to you, and we offer you some steps that you could take. Start an exploration team, review the materials that I'm going to show you in just a minute, examine your partnerships, look at your existing programs, develop a shared understanding, and determine benefit and decide to adopt or not. So I mentioned these 3 ISF fact sheets. We also co-created some webinars for each fact sheet. So you can go to this link that's at the top here, and you can access all 3 fact sheets, all 3 webinars, and all 3 PowerPoint presentations through that link. If you want to talk a little more with Tani and other implementers, we're doing interconnected system framework discussion hours, so you can sign up for our remaining sessions. It looks like Tani and I are the headliners for the May 7th. So if you want to hear more, come on back. That'd be a great time for us to get together. And then there's a couple of other sessions that you're welcome to join as well. The link for that registration is on this slide. Additional resources, the first few represent ones we've already mentioned. There's the Midwest ISF site where you'll find the implementation guide. There is an article from my Smart Center colleagues. There's the National Mental Health Technology Transfer Center Network. There's the our Northwest School Mental Health Supplement website, and then the Washington Integrated Student Supports Protocol will also be a good resource for you. The National Network put together a free mental health curriculum that has a trainer guide and a participant manual. And it is comprised of these 8 modules that are intended to be gone through in about an hour a piece. So you can access those from the National MHTTC Center, and you can also reach out to us and we can send you the link for those. But PowerPoints are there, the scripts are there, the resources are there. Don't create any of this work from scratch. Reach out and let us know if we can put you in contact with things that already exist. And then we are, as we're responding to COVID-19 with several partners, you can see at the bottom of this slide, have a well-being series that we invite you to join. All of these are free. We have an educator wellness series, a school leader series, dialectical behavioral therapy in schools, lessons for parents, and some live Q&A, and ambiguous loss, grieving in the time of COVID-19, and psychological first aid are some of those events that we're putting on. And you can go directly to that Wellbeing Northwest site to check those out and register for any. And then contact us at the Northwest Mental Health Technology Transfer Center. This is our school mental health site, one-stop shop for all the events and trainings and resources. Sign up for our newsletter. We send out blasts and monthly newsletters, and then connect with us on social media. So here is how you can reach out to Tani and I, and just want to thank Justin and the over 300 folks that stayed on to listen to this presentation.
All right, thank you so much to both of you. Again, all those links, the resources are on the OSPI MTSS webpage. So we can, you can access them there to find all the resources. If we can just, I know we're past time, but if we can just take a couple questions, would that be all right? So one question that we have is around, and this is a question for Tony. Do you have documents that outline the different roles that your team are playing or your staff are playing to support mental health?
Great question. So our mental health coordinator has created an entire, what would we call this? A procedural booklet of all the procedures that we're creating, that we have created. So we can get that and share it with you all, and then we could, then everybody can access our procedural book.
Perfect, thank you. Another question for Tony. How does the district get funding to support mental health for all?
I would tell you that the funding that we've used is, we did hire one mental health therapist, and we used our basic funds for that. And then basically our already existing positions, which are our school psychs and our social worker, were already in place, and that's funded from special education. But we were looking for providers that have clinical supervision experience, so then we could supervise and have, you know, a team of 16 mental health therapists, basically, that are giving mental health. So we're really doing it with not very much cost. The other cost that comes for us is we're paying those supervisors when they deliver classes. We pay them time to deliver the classes for parents and staff. So it's very minimal cost.
Thank you. How would you recommend someone initiate conversations at the district level for supporting mental health in a greater way?
I think it's a combination of utilizing the ISF documents that Kelsey shared earlier, kind of where you can get a needs assessment of where is your school at, whether from the mental health, from the PBIS, and then you know, we've talked about how to partner and work with other schools and do this work, but working with your community partners such as universities or other mental health buildings. What can you utilize any of those clinical interns that are really in their last year? Or, you know, I explain to people that they are, they have multiple supervisors, and they're done with their coursework, and they're really just delivering those services with lots of supervisors. So if you can tap into any of those agencies that are using those interns, or the universities, and then where we really need to think outside of the box is to start sharing these resources. Like I said, we're sharing some resources with Fork School District in Central Valley. Get outside of our box to make mental health for everybody.
Love it. And to tie into what you were just saying with the interns, I'm wondering this maybe a question for either of you. For districts that are really remote and maybe not close to a university, do you have some suggestions for how they could access some supports like that?
Well, I can go first and then maybe Kelsey could piggyback, but one of the areas that we're working with is Forks School District. They're pretty remote. I actually went up, traveled up there in February before all of this happened. And I talked with Kelsey about seeing if we could talk to universities about looking differently. Instead of traveling abroad, let's travel afar. So get some funding for some of those interns to maybe live and get funding to get them to live in areas like Forks, and then have their studies take place in Forks while being supervised. So that would be my suggestion for those cities and counties that are remote from universities.
Thank you. Maybe one or two more. Can you speak to the role of families within the work that you're doing?
Yeah, absolutely. We're doing a few different things with our families. One of them is they are attending our education classes together. So I'll give you an example. Our mental health therapist, she delivered a class on divorce. So we had the educator who attended, both parents who were divorced, they attended. And it was really a beautiful thing where they could come together and get psychoeducation together and talk about how they move forward with working with the student and their child. We've also created a parent partnership for our students with disabilities. And they are actually a parent partner where they can help guide parents walk along us as they work through our systems as well.
Thank you.
I would just add to that. I think one of the common concerns we hear is maybe we can't add families to our teams because we're talking, about confidential information. And I would just add that families can serve on those systems teams where there really isn't a discussion about confidential information about students. So serving on a tier 1 team to talk, more globally about those universal interventions, and then being able to provide input to how those systems are developed at tier 2 and tier 3. So I think those are just some perceived barriers that are out there and ways to work around that to make sure that we're involving parents from the very beginning and they're not an afterthought in this process at all.
And can you elaborate to that same point, Kelsey or Tawny, about community partners and some of the confidentiality concerns that may come with the community partnerships?
When we've been working with our community partners, if we've needed to, we've asked for different releases of information. But as we build our system, just like what Kelsey had talked about, we've been able to build our system when we're not talking specific, as well as we've also created several different memorandums of understanding and how we're working together. And that area has helped us as well.
Perfect, thank you. Well, we are at almost 15 minutes over, so I won't keep you with more questions, but I thank you both for sharing your wisdom, sharing your knowledge. Again, for everyone that has stayed on, thank you for staying on. We will post any resources that you still need. Feel free to reach out to any of us with additional questions. And the recording of this webinar will be online in the next couple weeks. So with that, we will end the webinar for this morning, and we'll see many of you around 1 o'clock for the next round.
Sounds good. Thank you, Justin. Thank you, everyone. Bye.